Hello, and welcome back to the channel. I'm Dr. Judy, and I had to do a video today about this topic in the news that is got everybody in healthcare talking. Did you hear about the shooting that happened where a gunman who they haven't found yet murdered a United Healthcare CEO in Manhattan in the broad daylight, and they still cannot find the gunman? And apparently, the bullet casings had the words on them: deny, defend, and depose. Now, this comes amid what a lot of us in healthcare have been saying for a few years now, is that the healthcare system is about to collapse. Many people in healthcare, especially physicians, believe and feel very strongly that the insurance industry has too much power and say so in healthcare decisions, and pharmaceutical industries also have too much power and say so as far as the way the healthcare system in America is run. And a lot of the comments online, I'm seeing that there's a lot of frustration from a lot of people who are frustrated with insurance companies. There are stories of people having things that are obviously medically necessary denied by the insurance company. And so I want to kind of share some insider information with you that can help you to make the most out of your insurance plan and help you to get the most out of a system that many times it seems like it's really not patient focused. It seems like it's driven by profits, driven by insurance companies' desire to make more money. And for those of you that may not be familiar, I've been practicing as a internal medicine physician, board certified for over a decade, and I also have worked for insurance companies. I've actually worked for an insurance company on the clinical side many years ago, and then I also worked for a different insurance company doing claims, reviewing claims, actually the one that reviews claims for medical necessity. So I can tell you a bit. I know what happens behind the scenes. So I'm going to share some of the information with you. So pay attention. So why this assassination is such a big deal is because it really just highlights how frustrated the American people is right now. How frustrated people are with insurance companies. I know that there are so many primary care doctors, specialists, physicians who are frustrated because they've ordered a test for their patient. They know it's medically necessary. They believe it's medically necessary based on their clinical experience, but the insurance company has denied the claim. So, what happens is that the insurance companies do make decisions based on evidence based, like the science, right? So, the insurance companies tend to be in alignment with one another. So they tend to have similar criteria for any given procedure being approved. Let's say a capsule endoscopy or a colonoscopy. All the insurance companies kind of tend to want to be along the same line. No one wants to be like way different than the rest and have extremely strict criteria. So they do tend to know what the other companies are using as their criteria. So for any given procedure, there's a policy. Every given surgery procedure, and then like for medications that are like the expensive medications, there's a policy for it. And so when a physician or a surgeon, gastroenterologist wants to do a surgery on a patient, that request comes to the insurance company. And for the company that I worked for, the nurses review a lot of the cases, and then some of it is automatic. Like AI is used a little bit. So some cases like just get automatically approved if they meet the criteria. They get approved and the nurses can approve. But if based on the policy, a criteria is not met, then that policy goes to the doctor. So nurses aren't allowed to deny cases, but they can approve. So the nurses see the case first. Typically, they can approve it if it meets the policy criteria. And if it doesn't meet, they'll send it to the physician for additional review to see if the physician, based on their clinical experience, will approve it and will see if it meets. Now, for a given procedure, let's say capsule endoscopy, that's a gastroenterology procedure. So the criteria for that might be something like, okay, they have to have had a negative colonoscopy in the past 6 months, or the hemoglobin has to have dropped by this much in this time period, or they had to have tried this first. That's generally how the criteria works. And so after the physician reviews it, based on their clinical experience, they have the ability to approve it. Or if based on the policy and their clinical experience, they don't think that it meets criteria and should be approved, then they will issue a denial. So that denial letter will then go back to the doctor that ordered it, and the doctor has um, the option to challenge the denial. And so they get the letter and they can schedule a peer to peer with the physician. So we um, if a physician works for an insurance company, they often, not often, but from time to time, would have to do peer to peers with the physician that ordered it. And usually on the telephone conversation, they will give you more information about that test, why they're ordering it, more clinical information. Sometimes that's not available or not in the chart. And you also do get the records too, as well, when you're like reviewing cases. So then you have a conversation, and then based on the conversation, the physician will make a decision after that. So the physician that orders it will get another letter whether it was approved or denied. So there is a process, just so you know, that when the insurance company does deny claims, that letter goes to the ordering physician and that physician can challenge it. And then also, if it goes far enough as far as the physician challenging it, there's even options where the patient can write a letter as well to challenge the denial. So you do have options. It's not like when the insurance company sends a denial, that's the end of it. And I would actually encourage you, if you are in that process where your physician has ordered a test, a procedure, and it's gotten denied, to look at the policy. Your doctor, as part of the denial process, whatever, they're entitled to the policy. So they can actually look at the policy that the insurance company is using to make that determination. I'm not sure if the patient also gets to see the policy, but I know that the ordering physician at the insurance company that I used to work for, they were entitled to having that policy. So they can look at it and see, what criteria are being used. And then even on the phone, when we're doing the peer-to-peer conversation, you know, it's a conversation. So we often would discuss the policy and say, okay, well, the policy is saying that it should have this. Now, the caveat to it is that there is always going to be a role for clinical experience. And what I didn't like about working for the insurance company when I was doing that job was that it almost felt like the insurance company felt like they knew better, or like they knew more than the ordering doctor. Like me, as the person who's not seeing the patient, I felt kind of weird, like making this decision based on this policy that in most cases it seemed like it was updated, but there are some of them that I definitely felt needed to be changed. And if it just felt a bit of a conflict for me internal, like having a conversation with a physician who's seeing the patient, who's trying their best, I know, to do the right thing. And you got this insurance company that's like, no, we're going to deny this. So if you got a denial, just make sure that your physician, I know they're busy, we're busy, so sometimes it's hard, but they can do a peer to peer, they can challenge it, and then you can as well. And generally, how it works is, I don't think that people really realize how much power they have when they speak and talk. So I know this is going to sound really bad, but your physician can do a peer to peer. Your physician can write a letter to the insurance company. You can write a letter. You can call. So just be persistent. Like, don't give up on that test or whatever it is that you and your physician, believes needs to be ordered. Because the insurance company's job and their goal, let's just be honest, is to make money. It's to make a profit. It's not to provide. This is my opinion. Their primary goal is not to provide the best care for patients. That's just the way I see it, right? They're profit driven first. Providing good patient care is secondary. They're not going to provide good patient care at the expense of them losing money. That's not going to happen. So that's what I mean when I say their primary goal is profit. So you have to understand how they operate and kind of get into the mind of the insurance company. And physicians, when you've been practicing for a while, you learn that you have to operate in this way. Like I know in primary care, I can't just order MRI casually, and you shouldn't, right? I'm very cautious about tests that I order. You shouldn't. You should have very logical reasoning for why you're ordering this test. You should have done this first. I generally practice that way anyway, because I don't like wasting, and um, I'm not one of those doctors that like order every single test in the world. When you're experienced, you basically based on the patient's history, you can pretty much narrow down what tests you need to order instead of doing like a shotgun approach and ordering every test in the world. So I understand that there is value to insurance companies so that the cost of healthcare in America doesn't skyrocket too high. But I don't know if they're really doing that much of a good job because I feel like healthcare in America is too expensive and the outcomes are really not that great. And largely it's because of the poor diet, poor lifestyle, the processed food, chemicals in the food, lack of physical activity in our society. So it's like we pay the most in healthcare per GDP compared to other countries, but our outcomes are poor. Like the quality of life for most people beyond age 70 and 80 is poor, in my opinion. It's filled with either sickness, debility, lot of medications. So I don't even know what we're really getting from what we pay from healthcare. But I just wanted to say that because I know a lot of people are frustrated with insurance companies. Physicians are, providers are. It's like so frustrating to get denials. And then when you order medications, you can have a patient that's stable on a particular diabetes medication, and then all of a sudden, for no logical reason, it's obviously probably money driven. The insurance company will be like, okay, this medication is no longer covered. This is no longer on our formulary. So you have to switch the patient to this medication. And it's like, that does not make any sense. And that's not fair to the patient. They've been on this medicine for years. And so, you can like write a letter, the physician can write a letter, but then they'll be like, no, you need to try this medication first and then prove that that patient failed on the medication. So it's like, you mean to tell me this patient is stable on drug A for diabetes? I must take the risk, switch them to drug B so that you can save money. And then I need to prove there needs to be evidence that they failed on drug B before you approve the drug that they were on before. Like, that's not patient-centered care. That is not the way healthcare should be. And I don't know what the solution to it is. I really do wish that insurance companies did not have as much power and say so as far as healthcare decisions, but they really do control a lot of it. And my first job from residency was actually working for an HMO, a managed care organization, um, Kaiser, basically. And one thing that I really liked about working for that organization is that you didn't have the denials, you didn't have different insurance companies to kind of contend with. There was like none of that. It was a really, really good place to work. I really liked actually working for like one insurance company. It was just different. It was just different. So just keep in mind, like it's challenging, especially for primary care, because they, for the most part, do have a lot of time restraints. Practices generally want physicians to see a certain number of patients because the more patients they see, the more money the practice makes, right? So sometimes it's like because the practice wants to make more money, they encourage physicians to see more patients, and that means you spend less time with the patients. But that's not really what's best for the patient. So I think healthcare as a whole is just really in a bad place right now. It's very much money driven, and I know that money is important. You have to make a profit, but it shouldn't be at the expense of a patient, right? It shouldn't be denying medications, denying procedures and surgeries that patients need, and physicians and providers should not be pressured to see the patients quicker in less time so that they can see more patients in the day so that the practice can make more money. And just so you know, I know that there are a lot of false rumors out there about physicians. Physicians are salaried. So there is no additional payments based on um, prescribing medications. There's no additional payments by seeing more patients. Some practices might have bonus instruct bonus in place based upon quality metrics. So, if a percentage of your patients have blood pressure that is controlled, their weight is controlled, the diabetes is controlled, you um, not if you working in a hospital setting, not having frequent infections, like things like that are what physicians are incentivized by as far as the bonus structure and payments. But there's no payment structure for um, rewarding patients for giving a vaccine or for prescribing a medication or for even uh, seeing more patients, really. Some practices have like a RVU structure whereby like if you see more um patients you might like get a little bit more, but I know that there's a rumor about physicians getting paid to prescribe drugs or to give vaccines, and there's nothing like that happening. I don't even know where these rumors come about. Physicians are really like, I feel like they have like the least, they have such little power in the healthcare system. Like, and physicians are very agreeable. Like, we come to work, we work hard, we really care about our patients, want the best for them. We're not the type to um, create a fuss and fight and argue, which is probably part of the problem because we just basically deal with whatever crap the insurance company hands us, and we may fuss and complain amongst our own circles, but generally physicians aren't, not in America, aren't the ones that's going to be going on strike like they do in UK and you know um protesting and stuff. We just generally don't do that. Sometimes you may see it happen, but just not often. So I don't know. I just wanted to share my thoughts as a physician who's been working for many years in both inpatient and outpatient settings and who's worked for health insurance companies on both sides on kind of what it's like. And hopefully this is helpful for you. Like I say, I know it's very frustrating right now in healthcare, but this is why I encourage people to take your own health into your own hands. Do not depend on anyone else other than yourself to ensure your optimal health. You have to know what your medications are, your medical history. You need to have it on a piece of paper for ease of being able to recall that information. All of your surgeries, your doctors have the telephone numbers and your phone. Do not depend on another human being to be the manager of you and your health. And you also need to, if you really want to live your best life and your healthiest, you need to really see food as medicine. Food is really where health begins. It's impossible to be healthy with, sorry, it's, what I want to say is, I believe that it's very unlikely. I don't want to say impossible because technically anything is possible. Your chances of being healthy are very low if you live an unhealthy lifestyle and have an unhealthy diet. So, health at the root of it, it begins with healthy eating, what you eat every single day. And the challenge with America, the food over here in the West, is that it's heavily processed. There's a lot of chemicals in the food compared to what is allowed in Europe. And I've traveled the world, so I know that it's a difference. Like, ketchup in America has high fructose corn syrup in it, but in Europe and UK and a lot of countries, they don't allow high fructose corn syrup. So the ketchup even tastes less sweeter. It tastes different. And when I visited African countries, it's even different. It tastes even less sweet because it's even less sugar there. So there's definitely differences in the food, the quality of the food. I find the food here has a lot of additives, colorings, flavorings, preservatives, like just a lot of things that are just banned in other countries, and it's not healthy. And then it's like we wonder why we have so much obesity, why type 2 diabetes is on the rise, even in children. And then people get medical problems because the food is crap. And then you have insurance companies that's like, oh no, we're not gonna cover that. It's like crazy. So eat healthy, eat a primarily plant based, plant forward diet, not necessarily vegan. I don't think that vegan is an option for everybody or that it needs to be for even most people. Eating some meat can be a part of a healthy diet, but without question, mostly vegetables, like a heavy, heavy vegetable unprocessed, very low or no added sugar diet is what's best for optimal health. And the second thing I wanted to comment was, interestingly enough, a few days after this happened, the United Healthcare CEO was murdered. Blue Cross Blue Shield changed their mind about a decision that they had made to limit anesthesia coverage for surgery. So they were going to set time limits on how much anesthesia coverage they would cover for particular procedures. And if the procedure went over that time limit, they were not going to cover anesthesia used past that time limit. This was supposed to take place starting in February of next year in Connecticut, New York, and Missouri. But after this shooting came out, after that murder of the United Healthcare CEO, and due to the outcry of a lot of physicians, even like I think the governor of New York and these different states chimed in, there was a lot of backlash and criticism, rightfully so. They decided to reverse their plan to cap anesthesia coverage. So I was really glad about that. I mean, the whole idea is ridiculous. Like, if a procedure is going 30 minutes past the predicted time or the expected time, then obviously there's a reason for it, right? I mean, they think that physicians are out here like crooks, just like extending surgeries for no reason. Like, there's a logical reason why a procedure is going to be longer than what the predicted time is. It's just so crazy that the insurance company even has the nerve to be like, we're not going to cover anesthesia that's over this time limit. So I'm glad that they reversed that decision. But we need to remember that we have power. And anytime they come up with crazy decisions like that, everyone needs to be in an uproar about it. Whatever way you can, whether it's on the internet, writing letters to your senators, your state, your governors. Like, I am so glad that that decision got reversed. So we still have a ways to go as far as um, being a healthcare system that's patient first. But I really like to give people power and to empower them to know that at the end of the day, what really determines whether you get sick, whether you even need insurance or not, primarily is the food that you eat. It's the lifestyle that you live, whether you smoke and drink, whether you're under chronic stress, whether you move your body and exercise, get regular physical activity, and how much sleep. If you address those lifestyle factors and habits, you can significantly reduce your need of um, needing to depend on the insurance company. Because to me, I feel like that's the ideal, right? To only need insurance when you go for your annual physical, maybe twice a year you get labs, or like an emergency if you have to get hospitalized. That's really the ideal situation, because once you got a chronic illness, the traditional healthcare system, the model is you're on that medication forever, for the rest of your life. There really is no algorithm in medicine, traditional allopathic medicine, to wean patients off medications. And I've seen this so many times in my career because I'm a lifestyle medicine doctor. I try and get patients off medications, actually. I'm very mindful of polypharmacy, patients being on too many medications. And I've seen too many instances where a patient, clearly based on the notes, needed to have been taken off a medication, like a blood pressure medication, and their blood pressure has gradually gotten low over time. And because this is not something that's taught in medical school residency, it's not really, it seems common sense, but I'm just going to say it like it is, because I keep it real. It's really not something that we are trained to do, because they teach us that medications are prescribed for life. It's like chronic. So I think sometimes physicians are actually scared to cut back on medications. I think they're scared that, oh my goodness, if I decrease the dose, this person's blood pressure is going to like go through the roof and then they're going to have a stroke. I think physicians are really afraid of that, but that's very rare and unlikely to happen. I find that as a patient gets older, particularly above 70, they don't need as much blood pressure medications as they needed 10, 15 years ago. So you really need a doctor once you're that age that really is mindful of, I don't want to say geriatric care, but like the changes physiologically that happen as you age. And they need to be mindful of, okay, is this person on too many medications? Do I need to lower the blood pressure medications? Because I've taken care of people in the hospital who's like on all these medications. They're on multiple medications that affect mental status, cognitive function, too many blood pressure medications. And I'm like, why are these people on so many medications? So that's what I'm saying. Again, you can't depend on anyone else to 100% know or be perfect, I would say, because um there are gaps in our healthcare system. There's gaps in the training of physicians. I think it definitely needs to focus more on nutrition. Very little of what healthcare providers in general, PAs and nurse practitioners, very little is about holistic wellness, nutrition, plant-based nutrition, if any. But I mean, there's so much information now. PubMed, anyone can access that. The internet, anyone can access that and learn this information. So just become the CEO of your health. That's the message that I want to share with you. Become the CEO of your health. Take ownership of everything that happens to you. Ask questions. Make sure that you understand the test that's being ordered for you and why. And don't just be like a passive participant in the healthcare process. Don't just be like, oh, yeah, I went to my doctor and they ordered these labs. I think that you should know why they're ordering those labs and maybe even do some research on your own so that you can look up and have an idea of, okay, based on your age, your family history, other labs that should be ordered that maybe your doctor did not think of, right? Doctors are human like anybody's. And just being real, if you knew how many patients the traditional doctor and primary care had on their patient panel, is really ridiculous and insane. So now, if you go to a DPC practice, a direct primary care, they have a lot less patients. The numbers I've heard are anywhere from like 500 to 800, I believe. I don't think DPC really takes more than 800, like as their total panel. But the last numbers I heard from traditional primary care, and I did traditional primary care many years ago, but and it may be different now, but the numbers that I was told was like 1,500 to 2,000. That's like the total number of patients that any one primary care doctor would have. Now, of course, you're not seeing them every other month or every 3 months, but that's a lot of patients to take care of. That means that you have to keep up with when they're hospitalized. All of their specialist notes come to you if they have, need a refill. So it's a lot to keep up and to manage. And I really, in my social media profile, try to get people to really understand that it's it's a lot of patience. I personally think it's too much. It's a lot of patience. And even for someone like myself who's very detail oriented and extremely thorough, um, primary care doctors do deal with a lot. They do a lot. So I would say personally, if I was someone that had a lot of medical problems, and if I was 70 plus, I would see a DPC because the access is better. Typically, you can get an appointment within the same week. There's not as much of a wait. Traditional regular practices are often booked out months in advance. And then also with direct primary care, you can also oftentimes, some of them have the phone number. So you can like call and speak to the doctor right away. Some of them have text messages. It's just better access for you. And the visits are also longer. Typically in direct primary care, the visits are like 30 minutes to an hour. So it's just more personalized care. And I've lately started seeing some practices that have been not in network for insurance companies, from insurance companies, or not in network with insurance companies. And I like them actually. I like the longer visit, the 45 minutes, the 1 hour. And then when you go back to your regular doctor, that's like a 15-minute visit. Oh my gosh, it feels so rushed. It feels like you got to get all your problems out, all the symptoms out really quickly. And you could tell that they're rushed. It's just better to see someone that has visits that are at least 30 minutes. I think that's the minimum. And it feels less stressed as well going to these practices that have longer visits. So I don't know if that's an option for you. I know it costs more money and often they're not in network with insurance companies, but the care that you get, the quality of the care, in my opinion, is definitely better. But you don't have to be involved with these insurance companies. The doctors are able to practice according to their conscience, their clinical experience, rather than being influenced, whether subconsciously or not, by insurance companies, right? Um, yeah. So I know this was a longer video than I intended. But hopefully it was beneficial, gave you some encouragement, some ideas to take back ownership of your health, and to give you a little bit of inside view about what healthcare is like in America behind the scenes. From someone who's practiced and worked in many different settings, so I really think I have a pretty good bird's eye view of what's happening. But just in summary, just know that many physicians do feel that the insurance companies and pharmaceutical companies control a lot, like too much of healthcare. And sometimes it feels like we don't really have as much freedom or ability to really just practice medicine, the way we know it needs to be practiced. And then with the electronic medical records, sometimes those can um, be a bit of a challenge for some people as well too. But overall, I think we have a lot to be grateful for. I think in this country, even still, we do have access, and although it's not perfect, nothing's perfect. You know what I mean? But again, these are just my views and my thoughts. And yeah, hopefully this is helpful, and I'll see you in the next video.